Welcome back to Body Beautiful. We'll be taking your calls with any questions, and we have an echo in the room about skin rejuvenation. Here's the phone number, 800-440-4884. And again, we'll be putting the number for the doctor's office during and at the end of the segment, so be ready to jot that down. And any advice we give you today, you certainly want a second opinion. Just before the break, you were kind of dissing lasers, and I thought that was bold.
I won't say that I'm dissing them. I use lasers in the office, okay? I think laser hair for hair removal is a fabulous idea. I think that vascular treatment, like of rosacea or of port wine stains or very small spider veins in the legs, perfect. The laser works beautifully. And I don't mean to be dissing. I'm expressing my own opinion, and it's scientifically but also clinically based that when we use lasers for resurfacing, we're injuring the skin. And the result that you get is a result of healing an injury. And my philosophy is to do as little damage as possible in order to obtain the result that we want. So whether it's, facelift, I want to do the least amount of surgery possible to get what the patient needs. I don't.
So many people want that, direction.
Well, I hope so.
Let's go ahead and go to the phone lines. Nancy from Santa Rosa, good morning. Do you have a quick question for Dr. Lee?
Yes, I do. I know that you're not supposed to have facial waxing done while using Retin-A.
Yes.
And I was wondering if it's okay to have the waxing done while using Obagi.
Not while you're using the Retin-A part of Obagi. So you can stop the Retin-A for 2 weeks before you're waxing, but what Retin-A does, as we discussed, is it makes those dead epithelial cells more likely to separate. So what can happen when you wax is that you can pull off the outer layer of skin, and that's equivalent to a burn. So we like to avoid that. You can, however, thread even when you're using Retin-A.
Okay, thread, you just
Do you guys know what threading is? Okay, well,
yeah.
Threading comes from the East somewhere, and it's Indian and Persian as far as I know. And I don't understand it exactly, but they do something about twisting threads with their fingers, and they catch the hairs and they pull the hairs out. So they can do some really elegant shaping. It takes a little bit longer than just waxing, but you can't wax when you're using Retin-A in any form, including with the Obagi.
Well, and also a point we should make, Retin-A, stay out of the sun.
Oh, Retin-A, Retin-A is a prescription strength medication. You need to be under a doctor's supervision. You need to be out of the sun. You don't have to be a vampire, but you have to do what I call practice safe sun, and that requires some education.
Practice safe sun.
You like that?
Yeah, I do like that. All right, shall we go to Shirley from, we just lost Shirley from Alameda. She had, her question was something about some lines on her chin. We did a show on this last week, and it was a very popular show. It was fun with fillers. Talk to me a little bit about what you would do.
Well, it depends on what the lines are from. And again, we talk about the botulinum toxin A as being something that relaxes muscles. So if patients are getting a lot of lines because they're squeezing their lips together for whatever reason, we can often improve that by using some muscle relaxer in this area.
And yet you don't want it anywhere around the mouth because you
want your mouth to, right, and exactly, and you don't want too much of it in your forehead, because if your eyebrows don't move, you look frozen. But you do not miss anybody's frown.
This is true, and hopefully we won't be missing mine.
No, that's why I love treating this area here.
Okay, and because those who just joined us, the doctor brought a syringe with her and surprised me with it, and she has a new product that is a Botox-like product.
Exactly. It's where I'm referring to it as the new Botox. It's a botulinum toxin A, which is what Botox is, and it's called Dysport by a new company. Competition is great. Has been found by the FDA. Has been approved by the FDA, so we know that it's safe. We know that it works, and we're happy to have it.
Okay, so basically it does the same thing. It paralyzes, or as you like to say, relaxes.
It relaxes the muscles.
And in fact, the injection was made here because normally I wear bangs, and so you don't see this sort of thing. So maybe we'll be pulling them back, and no more scowling. Unfortunately, we are out of time, Dr. Lee. Always a pleasure to have you with us. Very informative. For more information about Dr. Lee, you can call her 510-704-2170 or check her out on the web at artfulsurgery.com. And do join us tomorrow at 11 a.m. for another edition of Body Beautiful. Thanks for joining us. Really quick.
Follow me on Twitter, Dr. Elizabeth Lee.
On Twitter.
On Twitter.
Thanks for joining us. Have a good day, everybody. Bye-bye.